So I'm Louise, and Mr. Pink was my Siamese cat. Absolute love of my life, the most beautiful cat, the most piercing blue eyes. Like all Siamese, didn't really think he was a cat, thought he was a human being or possibly a dog. His nickname in the family was Dog because he interacted with us like a dog. He wanted to be with us all the time, he wanted to talk to us all the time, he yelled at us all the time, he kept getting into bed with me. He was the most lovely, affectionate, silly cat, very in your face. Everybody loved him, but he was mostly my cat and I adored him. What happened was we were going away for a while. He'd had mild kidney disease for probably a couple of years, but managed by diet, and that was all fine. But because we were going away for an extended period, we got a cat sitter, house sitter, who was looking after him. So while we were in America, we got a call from her to say, I'm not sure everything's quite right, I'm going to take him to the vet, and it all spiralled quite quickly from there. And we got a call to say that his creatinine was up to 900, and the vets in the audience will know that that's pretty awful and pretty much incompatible with life. And we will never know why, whether there was some acute kidney injury from something he'd eaten or what, we don't know. But anyway, he was in a very bad way. Because we were away, the vet was fantastic and knew how important it was for us to see him again, if we possibly could. And he took advice from a specialist cat clinic. And they said, if you keep them on IV fluids for long enough, sometimes their levels will drop back down. And sure enough, after 8 days on IV fluids as an inpatient, his creatinine and urea were back down to almost normal levels, not quite, kind of borderline abnormal, which was amazing, and we never thought that would happen. But, and this is where you came in, when he came out, he was still having daily subcutaneous fluids, which you did for us, and that was something that you can't ask of many people. It seemed like an awful lot to me when I first heard that's what we were going to have to do. And it's certainly not something where you can just ask a neighbour to pop round and inject your cat. But I think having seen you do it, and then having seen videos online and looked at some of the websites that other owners have put up to tell people about it, that actually it was doable.
So was it reassuring to see that other people were able to do it?
Absolutely, yes. And to be honest, I didn't think I was going to have to do it for long. So I thought that he'd been saved long enough for us to have, another 2 or 3 months with him. In fact, he lived for another 2.5 years, which was great. But it wasn't quite what I'd signed up for.
Did you feel like that at the time? Or is it only in retrospect?
No, it's in retrospect, I think, because what happens is it creeps up on you. So you start off with just the fluids, and then there was some intra, and then we had phosphate binders, and he got constipation, and there were all kinds of different things that you had to adjust. And each time a new thing comes along, he would sort of go stabilised for a while and then drop, and then some more treatments might be added in, and then he'd be okay again. And you just adjust and absorb it into your lifestyle. So you went from daily fluids to twice daily to 3 daily, and you don't quite realise how much your life is being constrained by it all. And certainly things like going away, we wouldn't have been able to go away if we hadn't had you able to step in and do it. So with hindsight, we were taking on a lot of work, but it crept up on us so gradually that I wouldn't have known at the beginning what we were in for. I'm very glad that we had him, and his quality of life was really good for most of that time.
I remember when we first started, it was like he dropped 5 years off his life. His coat went back beautiful, and he was all over the place again.
Yeah. And one of the things that we were talking about earlier is needing to know what kind of a cat you're dealing with, because he was really compliant. He was very good, and he'd sit there and kind of look a bit grumpy sometimes when you put the needle in his scruff. But for 30 seconds, then 60, then 90 a day, it seemed like a price worth paying. Now, I can't imagine doing that with the 2 cats I've got at the moment, because they would be off the ceiling, off the walls, we'd be chasing them around the house. He was just a very laid-back cat who I had a bond with. I knew.
That's right.
And
He'd reached the age where he knew he could trust us. I mean, maybe your youngsters will, if they get old and if they start to feel a bit ill.
Yeah, maybe they'll slow down. I don't know. But yes, he made it very easy. So I guess that's something that vets have to think about. I know it's a really difficult thing for them, where they've got this 3-way relationship with an emotional client, their own emotions, because trying to deal with very sick cats and deciding at what point do you say to someone this is not going anywhere, it's really difficult, and the individual animal, because their needs have to be reflected, and it's a really complex balancing act, I think, for vets to get that right. The other thing I wanted to talk about, I think, was the receptionists. Because I do work on human illness experiences, I know that when people have chronic illnesses, they often talk about being an organised asthmatic or an organised diabetic. I had to be really organised. I had to know that I'd got enough sort of wide gauge and narrow gauge needles, enough clean syringes, enough bags of fluid, enough Symintra. And the receptionists were brilliant at, I would ring up and say, I need, 5 green needles and 2 yellow ones. And they go, yeah, fine. And do you need any fluids while we're at it? We've probably got some down in the basement. And they were just wonderful, but also hugely sympathetic. And I think the amount of client care that receptionists do perhaps sometimes goes under-recognised. They're a really important part of the social contact, the emotional support that you get at the vets. And they sent me a lovely card when he was finally put down.
I think often also they can take more time than the vet who's constrained to a 10 or 20 minute appointment. And they talk to you.
Yeah. And we were also saying, that the importance of knowing the people involved, judging what an individual owner can or can't take on, because there probably would be people for whom what we did was too much. CKD treatment for cats seems to have expanded massively in the last few years. When we first started having cats, our first cat died of CKD, and it was really quick, within a few months, and all they seemed to have in the toolbox was steroids. And he went downhill very quickly and was put down probably 3 or 4 months after first being diagnosed. Then we had Polly, who went on for years on a chronic kidney disease diet, so the diet biscuits that came in made a big difference. Now, with fluids, many more cats probably can be kept going, but whether that's right for everybody has got to be I was going to say an individual decision, but it's never an individual decision, because it's this 3-way decision with the vet and you and the animal in mind.
And also, it's not just keeping them going. I mean, he was a really happy cat for most of that 2.5 years.
He was. I think the thing that probably it was the last 2-3 months or so when I started to think, at what point do I say this has got to stop? It creeps up on you so gradually, and there's never a clear point. When he had creatinine at 900, if I'd been here, I suspect, probably, we might well have had him put down. I don't know that. I've never actually asked the vet whether that's what the advice would have been at that point. I think he knew, because we were away, that it was a really odd situation and he had to try and do what he could. But nonetheless, creatinine of 900, you think this is probably a fairly clear decision.
Pretty catastrophic.
Pretty catastrophic. Whereas when it's these little accretions of another slightly more unwell cat, there's never any clear point where you can say, now, definitely now. Well, obviously there does come a point, and we reached that
and the
eventually.
Fluids sort of crept up. And I suppose with the fluids, you kind of got to the point where you knew you couldn't really give him any more, and it wasn't really making any difference anyway.
Yeah, though actually probably what did for him in the end mostly was the constipation, because I think that was what made his life more uncomfortable and miserable, and enemas and laxatives and things. So it was undignified. He didn't like it, and he obviously felt uncomfortable. Whereas with the fluids, like you say, you could inject a cat with fluids and he'd suddenly go, well, hey, I feel good now, and off he'd go. And the constipation was horrid. So I think that was the main thing that made a difference to his quality of life.
Yeah. And once it was all over, what did you think about it? What did you feel?
I felt great relief, because it was suddenly coming downstairs in the morning and realising I didn't have to get all the fluids lined up and the syringe full and make sure I'd got his medications all lined up on the counter. It was like, oh, so I just come down and put the kettle on. Okay. So it was good. I loved it to bits. It was worth every minute, and I would do it again. But it was.
So if you got the call again in New York, knowing what you were going to do, you would do it again.
I would, but I don't miss doing it.